Okay. Okay, so once again, if you don't want to see your face on the imagery here, you can turn your screen off. Otherwise, we're very happy when we go to our gallery view to see as many of your faces as possible. So thank you for that. Can I also tell you that when we come to our guest speaker, and also item number 5, our patient concerns for anything that you want us to discuss, please put your questions into the chat. So it's not necessary to put your hand icon on until we get to the patient concerns. That might be a different thing, but certainly while Lucy, our guest speaker, is talking, put the questions in the chat and we'll be able to put those to Lucy once she's finished her presentation. So I'd like to just quickly introduce you all to our trustees, and all I'd like those people to do is to wave their hand and tell you what role that they play within our committee and as trustees. So let me please kick off first of all with Nee Plange, who is our very popular chairman. Nee, good evening. Are you on mute?
Yeah. Yeah, good evening, David. Yeah, I'm the chairman of the Kidney Patients Association, and my role is to help organize the association and work with the trustees for the betterment of the patients and all that we do. Most of the patients come to me first and foremost regarding any issues, then I'll pass it on to the right quarters for us to discuss, and I'll feed back to the patient. Yeah. Thank you.
Thank you, Nee. Funmi, you are our vice chair. So I suppose over to you to explain how you help out over the course of a period of time.
Yeah. Hello, everybody. It's nice to have you here with us. You're very welcome. I deputize for Nee, deputize in inverted commas, because he hardly deputize anything to me. Very rarely. He deals with everything, but I'm there just in case something happens and he's away on holiday or something. But I participate in approving all the requests that come through, all the sorts of decisions. I participate in the decision making of the KPA. That's it.
Thank you, Funmi. All our trustees play a part in making decisions on how the money is sensibly spent, and the majority of them take part in some of the specific meetings that we have with the renal team at the Royal Free. Carol, you are our longest serving member of the committee.
Yes, hello everybody, and I wish you wouldn't put it like that. It makes me sound even older than I am. But yes, I have been here since the 1980s, so it's quite a long time. I'm not actually a patient, it's my son that's a patient. So I was a carer who's been sacked, now he's an adult. I put together the content which goes onto the website, and I'm also a trustee of the NKF. So I sort of have two hats, but it's nice to be able to have a meeting with actual members. We haven't been able to do that for so long.
Yeah, COVID. Jill, over to you. Good evening.
Yes, can you hear me?
Yes.
Good evening, everybody. I'm, as you can see on the membership secretary. You must update that 15-year-old picture, David, but anyway, perhaps it's better left as it is. I we've got a new database, as probably everybody on here knows. So that is what I manage. Sorry, somebody speak. And I. It's all right. And I sent out the email to everybody through the database, which is a very easy thing to do. I'm also a trustee and do my best to try and make sure everybody that the requests are suitable for our patients. And I'm pleased, even if I don't always agree, that the decisions that are made are very, very good. Usually people are happy with the results.
Thank you, Jill. I think I would also point out that one very important part of the role that you have played in the past is in assisting me as my editor when we used to produce our much loved and much missed KPA newsletters, which we had to stop, but I'll show you later and remind those of you, if you're not aware, that we have switched over to a website. But that was a big chunk of work that Jill used to carry out, to be able to check my every word and the words of the contributors for articles. So thank you, Jill. Lewis, I hope you're there. Good afternoon. Are you there?
Unmute yourself. Oh.
Lewis? All right, we'll come back to you if we have to. And our newest trustee is Peter. Peter, your description of what you do will probably be quite straightforward.
Yes, it will. Good evening, everyone.
Good evening.
I'm a very recently appointed trustee. The rules, although I have been sitting on the sideline for 7 months, the rules state that I cannot be the trustee treasurer, so I'll be doing the bookkeeping until you've known me quite well for 6 months. So I was formally appointed about a month ago. So I'll be dealing with the bookkeeping and helping with the accounts and the payments. That's my immediate challenge over the next month or so, is to get myself authorised with the bank and with HMRC. So I'll be dealing with gift aid. We've got one big one to sort out, but I've not managed to talk to Jeremy. Alongside all of that, I have been a patient at the renal unit at Royal Free since 2016. So I know quite a few of the renal team quite well, and I'm really happy to help out. Is that enough, David?
That's perfect. Yeah, thank you. And of course, you will be joining the rest of us in making decisions on how the money is spent, which is still a very crucial point. Thank you very much, Peter. I noticed Lewis has rejoined us. That's you are number 40 on the list. If you're there, please unmute yourself. Jill, have you got any way of being able to copy all our participants? If you can find a way of doing that, that would be great. Lewis, can you hear us?
Yes, I can. Hello.
Good. Ah, Lewis in the car.
Yeah, as usual. I did. Sorry, go on.
Okay, well, Lewis is our NKF representative, and no doubt driving around now, trying to go and sort out other patients, fellow patients' problems. Nice to see you, Lewis. I'd like to give one other mention to one of our former trustees, who I can see is tuned in here, and that's our former treasurer, Jeremy Gold, who's played an important part over the last few years in looking after the treasurer responsibilities, and a key part in decision making within the KPA. So Jeremy, if you can at least say hello so people can see your face, we'd appreciate that. If your computer works, are you there?
Yes, I think it's working this time.
Great.
Thank you for those kind remarks. But you do our fellow members no service by suggesting they should look at my face. But never mind, I'm stuck with it, and so are they. So there we are. Thank you very much, David and Nee.
Thank you. Nice to see you, Jeremy. Okay, let's get on then. Now, I'd like to introduce you to Lucy Willingale, who is a lead professional for Kidney Cancer UK. I'm going to hand over to Lucy. So over to you, Lucy, and good evening.
Thank you, David. Good evening, everybody. It's a real pleasure to be here this evening. I had a couple of conversations with one of the surgeons at the Royal Free about the importance of making people aware of kidney cancer. And he very kindly suggested that I got into contact with Nye, which is what I did. And then unfortunately I was welcomed. I was very grateful to be welcomed tonight just to have a quick chat to you just about kidney cancer, really, and what we do as a charity for support. I know obviously you all have renal problems, but I don't know if any of you do have kidney cancer as well, and please don't feel like you have to tell me that either. Okay, so I am the health professional lead for Kidney Cancer UK. I've been working in kidney cancer for the charity for I think nearly 7 years. I've got a real passion for kidney cancer. I used to work with all cancers, and then I realised that actually kidney cancer and kidneys in general, there wasn't always that much support, and I was determined one day to support patients that had kidney cancer and their loved ones. And then one night when I was up in the middle of the night with a teething baby, I came across the job and I was like, that's what I've been looking for years. And then I was lucky enough to get the post. So tonight is a very chilled out, relaxed chat, just a bit about kidney cancer and what we do as a charity to support the kidney cancer community. I naturally talk very fast, so if I'm talking too fast, please tell me to slow down. I won't be offended at all. Okay, so our motto at Kidney Cancer UK is to listen, inform and support. And as you can see, we're the leading kidney cancer charity for over 20 years. Why are we here as health professionals? At the moment, 64,000 people are currently living with kidney cancer in the UK. 13,056 were diagnosed roughly each year. It's projected by 2035, there'll be nearly 22,000 people diagnosed with kidney cancer. So kidney cancer, this always surprises me, statistic, is the 7th most common cancer in the UK, and yet I don't think a lot of people hear about kidney cancer, unfortunately. It's the 6th most common cancer in men and the 10th in women. And as you can see, the rates of kidney cancer are continuing to go up, and I don't know if that's a combination of lifestyle or better screening, I don't honestly know, and there's many factors I think involved. So this is a really important slide so everybody knows about awareness of kidney cancer. The common signs and symptoms of kidney cancer is blood in your urine, persistent back pain, especially between the ribs and the hip bone. And I know personally the amount of people, all of us at some point, we'll do a bit of gardening and we'll get a bit of back pain, and back pain can mean so many things, but it's actually a real key indicator for kidney cancer, and unfortunately people aren't aware of that. GPs as well, so it's something to be really aware of. A lump or a mass in the area of your kidney, so sometimes you may occasionally feel like a lump around your back area on your sides. An abnormal red blood cell count, thank you. High blood pressure. Am I okay, David? A thickening of the blood, a tiredness, weight loss and a loss of appetite, and a persistent temperature and heavy sweating. Another thing that patients mention to me quite a lot is they have a constant cough, which can also be, it's research looking into as another symptom of kidney cancer. Please tell me if I'm going too fast or anything. So as a charity, we were dedicated to reducing the harm caused by kidney cancer. And we achieved this. We have, for our health professional team, we have 2 nurses, a full-time counsellor, a healthcare assistant, and a radiotherapist. Increasing awareness and knowledge about kidney cancer. So we provide support and information to those affected by kidney cancer. We're also very passionate, I am especially, about research and training programs, especially training programs to train nurses and GPs about the symptoms of kidney cancer. So hopefully people get diagnosed earlier on than late stage, which obviously an early stage cancer is far easier to treat. We do a lot about awareness and knowledge. For the last 7 years, we've run the only UK kidney cancer focus survey. And like, the patients are the experts. And I have learned so much about kidney cancer by all the patients and their loved ones kindly carrying out the survey. And from you wonderful people that do the survey, we learn, what's missing. For example, last time I learned, and it scared me actually, that something like only 6% of patients are offered clinical trials. And from that, I started doing webinars on clinical trials, getting clinical trial doctors to come on and talk to the patients, explain to them what a clinical trial is, explain to them how to get on a clinical trial. So everything we learn from, we react basically in the good of the kidney cancer community. We ran 4 surveys on the effects of COVID-19 in the kidney cancer community between April and November of 2020. That brought alarming rates actually of the mental health affected by being stuck at home with kidney cancer. From that, we did a lot more online support groups. We've created the annual Kidney Cancer Awareness Week in the UK, and it's been running for 8 years, and that is literally a week of just everybody wearing green, a real awareness of kidney cancer in the newspapers. People light up their local buildings green. It's just making a real power that actually kidney cancer exists. We engage with the media and we influence those that make a significant difference to government and policy makers. We do a lot with NICE, and in Scotland we do a lot of the SMC, which is the Scottish version of NICE for those that don't know. We constantly are doing work with NICE to get more drugs approved. We write and share any up-to-date news and information. And we support all the big campaigns like World Kidney Day and the Blood in the Pea campaign. As I've already mentioned just a minute ago, we do our Kidney Cancer Awareness Week. And as you can see, we've got buildings lit up green here. We've got the build. This is my geography being tested. Cambridge, I think that's Cambridge. And then, I think that's Portsmouth lit up green as well. And it's basically, please tell me if I'm wrong on that geography as well. The idea of it is you wear something green, and we do, oh gosh, it even says on that, now I've read it, Portsmouth and Ely Cathedral, there you go, Cambridgeshire and Portsmouth. And this week, and basically the idea is just to maximise people's awareness of kidney cancer and the symptoms of it. And it's quite amazing actually, the amount of people that come forward. Do you know what, I did have blood in my pee, I went to the doctors, and now I've been diagnosed. So it's good impact. Obviously we wish people didn't have kidney cancer, but through our campaign people become more aware of kidney cancer, and that seems to be going really, really well. So for example, in our awareness week this year, as you can probably see, we did 40 pieces of articles to national papers, 465 million people on our social media, 14 pieces of national press coverage, and 17 social media posts managed by influencers and celebrities. I can go on, but I don't want to bore you with all these statistics. So the idea really behind our charity is providing support and information. As clinic time is limited, patients often need extra information about kidney cancer, and that's why we're here. We support people anywhere from the journey. I'll get people that ring up and go, I think I've got kidney cancer, or I've got to have surgery, or I'm now metastatic and I'm scared. And from that, we run online support groups. We have the most amazing kidney cancer counsellor. Can't get my words out. I think this is the only one in the UK. So anybody that rings our support line and they need that mental health support, which we all do at some point. I'm not mentally health trained, so I do referrals to our mental health counsellor who is incredible. We do coffee, cake and chat groups, and we separated them now for our surgical groups, our metastatic and our carers. We also do live webinars where we talk about the latest drugs or the latest surgery. One thing we started doing, it's gone really well, is we do art therapy sessions online as well. The first one, everyone was like, oh, I'm not drawing, but it's become really, really popular. It's just another way where people can talk about how they feel about living with cancer. And it's gone far better than I ever expected, actually. And I think especially for those that don't want to talk, they'll draw it. An example of that, there was an elderly man who wouldn't talk about his cancer, but he was in World War II, bless him, and he drew a picture of his plane flying into his cancer, and it was like he was on his second war now mission. And I thought it was a really clever way of but he wouldn't talk about it, but it was his way of just expressing how he felt. So just different avenues. So obviously everybody's affects differently with kidney cancer. We have a massive Facebook support group as well. It's all closed, so it's secure for those that are in it, with over 2,000 members. It's probably gone up, to be fair, by now. We also have benefits advice, and we do financial support in local areas. We set up local support groups around the UK. Obviously they all went a bit closed, shall we say, due to COVID. We're starting to open them up, even if they start up on Zoom, like we are tonight, and then eventually they'll be face to face, we hope, in time where people feel comfortable, because obviously a lot of them are on immunotherapy drugs, and it makes them more at risk of COVID. So we have to be so careful. It's a fine balance what we can and can't do for their well-being and the safety of the patients. And as I've mentioned, we have a kidney cancer counselling service. It's 1-to-1. It's basically for anybody affected by kidney cancer. And what I love about it is it's a completely free service. So anybody can use it. And we do on a telephone, mainly because, I'll be honest with you, we've only got one counsellor to cover the UK. And also everybody can do it from home with a cup of tea and a biscuit. We also have something called the Accord, which basically we are trying to get guidelines for kidney cancer throughout the UK, because there are no approved NHS guidelines for kidney cancer. So we're doing a ridiculous amount of work behind the scenes trying to make it legal, like a legal pathway with NICE and with the NHS. We also do a lot of supporting research. Professor Grant Stewart is a trustee of ours and an incredible surgeon, and he's looking into a national kidney cancer screening programme, because that's everything. It's in the up on the ranks. It's quite high up of being one of the most, I think it's the 6th most popular cancer in men, but there's no screening for it at the moment. Whilst obviously you do for your bowel, your lung, your prostate, etc. So it's something we're trying to get more into. And Maxine Tran, she is an incredible surgeon at the Royal Free, actually, and she's looking at the renal cancer biological marker. And we're constantly supporting research, but obviously we're only a little charity, so we don't have the millions of money we wish we would have, but we always give what we can to support research. So we do a lot of support and information. You can see in the right hand corner there's booklets that we send out for patients that are metastatic, that have surgery, or those that are just getting diagnosed and just got to get their head around everything. Everything is free of charge, and very much so. And we used to do face-to-face big living with kidney cancer days. Obviously, because of COVID, they've all stopped. But actually, in a funny way, it's worked really well, because instead of seeing patients once a year, say in Birmingham, we see them weekly on Zoom. And it's a bit like tonight with all you guys. It's created a really tight-knit security for patients where they can talk and they can feel. And there's some really lovely bonds and friendships that have grown organically from it. It's starting to be a real support community. And I love seeing that grow week on week. You can see there's some pictures here just of some of the webinars we do. So if a patient, because I had many patients that kept coming to me, Lucy, we don't really understand the impact of having surgery. And I was like, you know what, that's fine. No one does until they go through it. So I created a webinar with a couple of surgeons and a nurse, and we all talked about surgery. So it gave patients an idea of what they were going to go through. And tonight we videoed it, and it's just on our website, and it's just other ways of giving patients information when they have their surgery, basically, or their treatment. And And as I've mentioned, we also set up local support groups. And we're able to give small funding, you know, to pay for like the teas and coffees. Biscuits are obviously always important, and the venue. And it's literally just a way of supporting those that are trying to run them, because it's not easy to set up a support group, as you all know. It's not easy to try and pull everyone together. And yeah, so we have our coffee, cake and chat groups, which I've already really mentioned online. And we do it every week. We tend to have one or the other. Tomorrow I'm doing 2 carer support groups. Last week I did a surgical one. The week before I did like a metastatic group for the those with advanced kidney cancer. So every week we'll go into another group of patients just to support them or their loved ones. We also have a nurse training program I'm really proud of, and it's for those, especially those young nurses that qualify, that haven't heard of kidney cancer. It's a free course to help them learn about kidney cancer so they can support their patients. And it all goes towards their CPD points for the nurse registrations and all that. And that's about it really. So thank you for listening. I hope that wasn't too heavy or just quite informal really. So thank you very much.
Thank you,
David.
Lucy. Thank you so much. You're a very enthusiastic representative of your organisation, and that really was a very thorough breakdown to explain what you will do. We've still got someone wanting to join us, 43 people. Can I just say that things like your clinical trials, this sort of area of research is always of interest to myself and the KPA, and if there are videos or explanations or ways of promoting that we can jointly do on your behalf on our website, that would be great. Carol, who you met amongst our trustees earlier, looks after the website, and we can obviously link our website to your website for anything that's relevant. So you know, that would be a nice area to be thinking about. I can't see any because this is such a complicated area.
Yes.
I'm just wondering a couple of things. First of all, what kind of relationship do you have personally with the Royal Free and our kidney cancer team?
So the Royal Free, so Maxine Chan, I think I mentioned, she's one of our trustees. I've done a few, and I'll be honest with you, in the past, well, I say in the past, before COVID, I did 3 support days. We used to call them like the London Kidney Cancer Day, but we always run them out the Royal Free because I'm sure you all know this, but the Royal Free, I'm pretty sure, is the biggest kidney cancer centre in Europe.
Yeah.
So we work very closely with them. All our booklets, the Royal Free use and they hand out to their patients. They refer quite a few of their patients to our counselling services, which of course, and also they're a great support. I'm able to ring the surgeons, you know, and I don't know everything, far from it. I'm not a surgeon. I can ring the surgeons, you know, I go, do you know what? I don't know what this is, or can you give me some advice? So I've got a patient that's got this, and we just work really well together, and they're an incredible team. I feel very valued to work with them, or like part of them, if that makes sense. And what I would say is I am yet to hear a patient tell me a bad experience about the Royal Free, just how well they're cared for. So we were doing a lot of patient days, but obviously, and I hope in time they'll start up again. And we're also doing something called butterfly boxes, and they're kind of like well-being boxes for those that when they're diagnosed with kidney cancer, and we're piloting that hopefully at the Royal Free. And we do, I probably talk with the Royal Free every couple of weeks, every week. And yeah, we work very closely. They've been an amazing support to us, and I think we have been to them as well. And I've done a lot of talks at the Royal Free about kidney cancer, because especially like the mental health side of it, because we've got the counselling service, we've got all that, we've got the financial, so we kind of work pretty well together actually. And Maxine, yeah, they're brilliant to you. Maxine Tran, like I say, she's one of our trustees. and she's wonderful. They are all wonderful. So
That's good. That's
answers
good.
that.
I've got a question here on the chat, but I'd like to ask, before I ask that question, to our members. I've seen the number of faces that I recognised, and I'm very pleased to be able to see those people. And there's a number of faces and names that I haven't seen before. So what I want to ask for people, if they can give us some input, is for those people that have joined us specifically for to be able to listen to the kidney cancer discussion, the reasons for why they wanted to hear, and whether or not they are actually patients, and how much help they've been able to have, and how much were they aware of Kidney Cancer UK. So if people are able to, if they could either put it in the chat or put their hand icons on, we'll come to you. The question that has been asked here is, should one be concerned if blood is found in the stool instead of urine?
Okay, can you hear me okay? So if it's in the stool, I mean, I'll be honest with you, you're probably best to go to your GP. Would be my advice, just to get it checked out.
Because what? It could be anything.
Yeah, it could be anything. I mean, yeah, with kidney cancer, it tends to be it's in the urine, it's blood in your wee, but it could be all sorts of things. So, I mean, sometimes naturally we do get blood in our stools, don't we? But I think, yeah, my advice would be just to go and see your GP.
Okay, thank you. Naran, good evening. You're muted at the moment. So
Can we stop sharing, David? Would that be better? Yeah? Can we do that? Would that be easier for you?
Yeah, that's
there you
lovely.
go. And then you've got complete control back.
Brilliant. I've got lots of very nice faces. I can even see my cousin there.
Oh, that's nice.
Hi. Okay, Naran, over to you.
Hi, David and others. I've been a renal patient for a long time. I had a transplant that lasted 22 years, but I'm back on dialysis now. And I've always been cared for by St Mary's Hospital, Hammersmith Hospital, and I've recently joined the Royal Free Hospital, and I'm now being cared for by the Royal Free Hospital. And I've always been a member of the appropriate KPA whenever I've been on dialysis. When I've been on transplant, I felt I'm free, and I've just kind of forgotten I'm even a kidney patient. And so I have lost touch with KPA, having had transplant for a long time. And having joined the Royal Free, I thought I'd become a member of the Royal Free KPA, and I just became a member about a few weeks ago, I think. And I got this invitation to join this meeting. I wasn't aware it's a kidney cancer lecture or talk, but I'm glad that I joined, and I'm glad to hear everything I've heard today. I've always tried to contribute to the KPAs I've joined in. In the last KPA I was with, I was a newsletter editor, but my background's IT, and so I like to sort of help out if I can.
Well, that's great, and it looks like you might have just worked your way into the KPA hierarchy. But what I'd like to say to you is that if you get in touch with Nee, who's our chairman, and well, he's obviously heard what you've said. Any way that you can help and get involved with the KPA, that would be great. And apart from Nee's email address, the KPA address is rfhkpa@gmail.com. And of course, you can go to our website, rfhkpa.org. So thanks for those comments, Naran, and we hope we can be in closer contact with you. Yeah, Jeremy.
I hope so. Thank you.
Thank you. Jeremy.
Yes, thank you, David. A question, if I may, for Lucy. I'll just start tongue-in-cheek saying you're very naughty in encouraging your patients to eat cake and biscuits. That can't be good for them.
But you know what, Jeremy? Hardly any of them eat cake. I'm yet to see somebody actually eat cake on our support
well,
group,
the Prime Minister is eating all the cake that we have in this country at the moment. The serious question is
Yes.
that the very mild kidney trouble that I have has been caused by a disease called vasculitis. And it's a rare disease, and it's absolute pot luck as to whether a patient who's got vasculitis will actually get diagnosed quickly, or could literally go for years being passed from pillar to post while clinicians try and puzzle out what's wrong with them. If you land in a place where there is a specialist vasculitis centre, which I did because the Royal Free is such, then you'll get very well looked after. But if you don't, then it can be very, very difficult. And from one or two of the remarks you made, I'm just wondering if it's a similar issue at all with kidney cancer. Or if somebody has got kidney cancer, are they very likely, wherever they present, going to get a timely diagnosis?
That's that kind of that question. So basically, sometimes people have no symptoms whatsoever. Can you hear me okay?
Yes, indeed, yes.
Oh, good, thank you. So sometimes people can have no symptoms whatsoever, and other times people have back pain, like I said, or blood in their pee. They're the two most common ones, I would say, and then they'll go to their GP. But I think a lot of times, sometimes it's quite luck whether you can get a point with your GP who knows about kidney cancer as well, and can say, do you know what, let's get an ultrasound, let's just check. But other times, I think there's the figure we have, and I can't remember exactly, but it is around 60% of people that have kidney cancer from our survey, they found out by accident. A lot of times I think they had prostate problems, for example, and when they're scanned for an ultrasound, or they're scanned, it shows that they've got kidney cancer. So it's a lot of times it's accidental findings, actually, that they've got kidney cancer. I mean, I had a lady last week who, bless her, had a car accident, and they scanned her just to check that she was okay internally, and they found out she had kidney cancer, no symptoms whatsoever. So it's a real mixture, to be honest with you. Sorry, I haven't given you a black or white answer there. I know I haven't, but some people don't have any symptoms whatsoever, and some do. But I would say, I think also just trust your body. I think sometimes we might not know what's wrong, but our gut feeling sometimes tells us something's not quite right, and to go to your GP. Does that answer the question?
Yes, that's very helpful. And in my case, I found out quite by accident. And I just wonder, I mean, is there an age relationship with kidney cancer? Is there something one could say, well, perhaps there ought to be some sort of regular screening for people above a certain age? Or
I think,
not work, or just be so expensive as not to make sense?
There's a lot that goes into it, and a lot of people, I know there's a trial in I'm sure it's Yorkshire, where they are scanning for lung cancer, and they're just bringing down that scan a little bit further down so they can look at the kidneys as well, as part of the lung cancer screening. So it's not as expensive as many, because basically you can do it over on ultrasound. But I know there's lots of talks whether that will happen, I don't know, but I know a lot of health professionals would like it to happen, whether they do a screening program. So does that part of that answer the question?
Yes, indeed. Thanks very much indeed. Thank you.
Maybe there will be one long term. Let's hope.
Lucy, is there a big difference in the expertise amongst hospitals looking after kidney cancer? Because I say this because I know for a fact that I've actually got two good friends who both had kidney cancer, and actually they were treated at other hospitals. And one of them in particular, whilst he was being diagnosed, and he'd made a decision that he would have the problem kidney removed, I spoke to, I won't name the person, but one of our lead surgeons, who said to me, please tell him to come and see me, because what you're explaining to me regarding the size of the tumour, we can actually almost certainly look after that, which another hospital probably doesn't have the expertise to be able to do that. Now, okay, you know, thankfully, if the Royal Free is the biggest in a unit, kidney cancer unit in the country, then it's great if we have that kind of expertise. But is there a difference?
I mean, I wouldn't like to say there's a difference, but I think things like the Royal Free, for example, you've got the robot. Not many hospitals in the UK have the robot that can take it out minimally. And I think there's different operations that can be done, like the robot. There's not many robots in the country. But I think every surgeon's capable, and they have to be capable to do the surgery, obviously. But like you said, David, it is a specialist centre. It's a massive centre. And obviously you can't expect the hospitals, you know, in the rural areas to have, and I'm not saying the robot's right for everyone at all. It's not. It depends on, you know, size of your tumour and your criteria of you. Sorry, the robot, I do apologise, Natasha. The robot is called the Da Vinci, and it is literally a robot, and it can remove a tumour off a kidney. It's called a partial nephrectomy. They basically, it's almost like you've got, what have I got here? My phone. So my phone is like the kidney, and it can almost remove, say, the black bits of the tumour at the top, and the robot can go in less invasive, and it can cut out that bit that needs cutting out, basically. I'm sorry, that's probably not a very good way of explaining that. But it's just like the surgeons use it. It's their hands, but it's the robot's like tiny like equipment that goes into the body to remove the part of the tumour that needs removing, basically. But yeah, I wouldn't like to say, David, but you're right. There are specialist centres of people, things like they have the robots.
Yes, I mean, the interesting thing also is that the surgeon who learnt his technique and everything about using the robot in the States said to me that he couldn't perform normal surgery to remove a kidney, but whatever he could do with the robot was all that he needed to do. And it's quite interesting, isn't it, when you think that here's a man that has a job to do, and he's top of his profession using the robot, but he couldn't do a live operation. But as long as you've got that robot, that's great. I just sort of it's always good reading out good messages, so thank you, Gay, for sending this message in the chat. I had a successful kidney transplant. My son was the donor 3 years ago. I can't thank the Royal Free enough for their kind and caring both before, during, and continued support. I've been very lucky. Both my son and I are well, and will be happy to talk to anyone going through this to support them. And in fact, that's Irene. Irene, please send me your email via the RFHKPA Gmail account, because as you are the recipient of a living kidney transplant, I spend a lot of time promoting living kidney transplants, and I'd be very happy if you wanted to get involved in doing some work in that area. So thank you for that. So Lucy, I think we're going to wrap up here. You've been wonderful. Thank you so much. And I'll compliment you on your presentation, which was full of joy and enthusiasm. And any way we can help jointly between our websites, that would be great.
Definitely. And thank you all for having me. And honestly, any questions you guys have, please just, get in contact. But no, thank you so much for having me. I think it's so important. And what you do here is amazing, David. I love it. It's brilliant. Your team.
Try our best. Thank you.
I can see,
okay,
and well done you, because it's not easy to put it all together, is it? So well done you.
No. All right, Lucy. Thank you. We'll be in touch.
Well, thank you.
Bye. You're welcome to stay for the next short part if you want, or if you got things to do. Don't worry, we'll understand if you disagree.
David Fumi had a question, which is on the chat.
That's
Ah,
okay.
right,
I wait.
okay.
I don't mind. I can wait. I don't mind whatever you guys prefer.
Is can a transplanted kidney have kidney cancer? And the answer is yes. But
Yeah, Lucy, do you want to?
Thank you, Jill. Yeah, I think Jill's answered it. Thank you.
well,
Bless you. Thank you, Jill.
no, you better enlarge on that. I'm no expert.
I think it's quite rare though. But yeah, and I think again, obviously getting kidney cancer with renal failure again is quite rare. It's not that common. So I don't want to scare anybody either tonight. It's the last thing I want to do. Thank you, Noran.
All right, Lucy, thank you.
Cool.
I've just put up on screen the website, just for those of you that don't know exist, and that is really our replacement to when we used to do our newsletter. And what you can see there, although I won't spend too much time going through it, we have our featured items on the right hand side. So that keeps on updating with events, clinical trials, items that can be of short-term interest to people. So it's always worth going to the website to see what's going on there. Okay, if we can, do we have any patient concerns regarding your treatment? Anything that anyone wants to raise anywhere amongst our group of happy patients? Anything? No. Jill, okay. Oh, here's trouble.
No. It's just that a lot of people might be interested in this because all the testing kits are no longer free, except for people who are immunosuppressed. And I just wondered if anybody knows how one gets hold of them or what happens on that score. Yeah.
I do, Jill. They're going to write to you all and tell you what you have to do.
Oh, right.
So the hospital is going to write to everybody who's immunosuppressed, and they all deal with their own, and they will tell each of you what you're going to do. I don't know when you're going to get the letter, but it should be in the next week or so.
Right.
Yeah, I've already received not only that letter, but I got a box with I don't know how many lateral flow tests, maybe a dozen or 10, and I got a letter signed by Steve Powis, which was explaining that as for any of us that are extremely vulnerable within that classification, that if we test positive, to get in touch immediately either with our GP, with the renal consultant, or our own doctors to report it, and they have a number of treatments that they can give us. I've also spoken to a couple of people that have tested positive that were extremely vulnerable, and within 24 hours got the treatment from their local hospital. And similarly to other, the people out in the outside world, the majority of these people are not getting serious impact. But I have to say that, when you hear the stories that there are 4.9 million COVID patients reported last week, and I can see, Peter, your image has come up on my screen, and both you and your wife had COVID in the last week or two. You're going to say, if you want to say something, unmute yourself, please.
Me?
Yeah.
Okay, two things. I didn't know that the people who are immunosuppressed will carry on getting them free. I'm one of those people, and I haven't had the letter as you have, David, so I'll follow that one up. I just wanted to add a little bit to the business about the antiviral drugs. They've got a few licensed, but as I found out the wrong way around, it only works if you declare your positive tests straight away and you get the antivirals straight away. So mine was dragging on. So I got in touch to say, can I get some antivirals? So I was about 8 days in, and I was told they don't work at that time. You've got to start taking them very early on.
This is the trouble. There's not enough information. I think this should be somehow conveyed to us, because I mean, I knew that, and we've all been sent a PCR test which you have to then submit. And as soon as you submit that, you should get the drugs. But they don't. There's nothing.
Okay, what we'll do for our members, I'll pass on to Carol my letter that was signed by Steve Powis, and we can put that up on the website. I think we will make the point to the renal team either tomorrow or the day afterwards that they need to get off their backsides and make sure that if renal patients haven't received the information. Andy is making a good point there, that one way or another we should all have, if we are extremely vulnerable, we should have PCR tests on hand for ourselves. And the only time I'm hearing people with concerns about that are the people that say they won't be able to afford to pay the £2 or whatever it is for a test. But I'm pretty sure that anyone that is certainly classed as being extremely vulnerable will receive a package in the post. Thank you to all of those people that are putting in messages for being grateful for the talks. So that's really kind of you all, showing your appreciation. If there's anything else anyone's got, because we're losing a few people now, although we've still got 32 of you. Anyone else want to raise any points? I just want to tell you also that we will be having our monthly meetings, but as opposed to, there will be on occasions when we hope we'll have an interesting talk, and obviously we'll be telling you that by email, but also selectively we will go round to the various dialysis units. And the reason for that is to try and let those units know in advance that we want to concentrate on, let's say, Tottenham or Barnet or Camden or wherever, for those patients to be able to raise their own concerns about their own unit. And that doesn't just mean dialysis patients, for the units where low clearance or transplant patients see their consultants. And we will have on hand a member of the team that, as either a senior nurse or a doctor. So if that kind of thing will be of interest to you, keep your eyes open for our emails, because we will let you know. But other than that, I'm going to wind up now, if I may. Thank you so much to everyone that attended, and I hope that it was of interest, and we'll see you again sometime, I hope. Thanks, everyone.
Thank you very much.
Keep safe. Bye-bye.
Bye.
Thank you.
Bye-bye.
Bye-bye.
Bye.
Bye.
Okay, thanks. Bye-bye.
Bye-bye. Take care. Bye-bye. Thank you, David. Thank you, Nye.
Thank
Thank you
you.
for everyone.
Thank you.